help with resume building, sort of the same types of services that hopefully you're getting access to in your undergraduate program. You'll have access to at the graduate level. All of our schools do have a career services office that really helps. We actually, at Hopkins, I know we have a nice career service day where they bring in different programs and different opportunities, not only in the local area, but nationally as well. It's one of the largest public health conference or career fair. So it's a really great opportunity. Even this year, you guys can get involved with kind of just to figure out what kind of organizations are out there. We also just provided just a visualization of the different types of organizations. I'm sure some of them look a little bit familiar to you, but certainly this is also something good to look at to see maybe internship opportunities now in your undergraduate program, or if you're thinking about a master's program. The nice part is some of the internships are extended, so again, kind of the 4 to 9 month periods, so you can really have a chance to not only get the experience, but sometimes those internships actually lead to employment afterwards.
Okay, so hopefully the last part of our presentation has either reaffirmed your interest or at least started to get you thinking about pursuing a graduate degree in public health. But another really important aspect of graduate education is figuring out how you're going to finance that. And so the last part of our presentation is really going to cover financial aid. So first I'm going to cover just some different terms that we use to get you familiar with those. So first, institutional aid. That's all aid that we offer at each of our institutions. And it's usually donor-specific aid. And so I would certainly encourage you, as you start applying to schools, to make sure you're looking on each institution's website to see what type of institutional aid is available and what you might be eligible for. Also, all of our schools offer some type of merit-based aid, and that's really going to be how your application fares against all others in that cycle. We also offer need-based aid, which is really your estimated family contribution as indicated on the Fafsa application. Who here in the room is already familiar with filling out the Fafsa? Okay, so a healthy number of you. So it's a really similar process from undergrad to graduate school. And so it's really important, one, that you pay attention to the deadline for Fafsa. The deadline to complete the Fafsa application is February 15th. So you're actually going to be completing the Fafsa application before you've heard back from schools on whether or not you're admitted. For most of our schools, we start releasing decisions mid-February to late February. So you don't want to wait until you hear from a school on whether or not you're admitted to apply for financial aid, because by that time, the deadline has passed. And so really, this is something that you want to do sort of in line with the rest of your application. I should mention too that it says apply early because this year Fafsa is actually they're opening their application earlier than they have in past years, so it actually opens October 1st this year. So even if you get that out of the way before you even start your public health application, that way it's just sort of done and you don't have to worry about it. And the next slide is really, the point here is that even if one of our schools offers some type of financial aid package, at the master's level, it's typically not going to cover 100% of the tuition. Typically, doctoral programs, as you may already know, are fully funded. But especially for master's programs, you really want to think about that gap. So even if we offer you a financial aid package, how are you going to pay for the rest of it? And outside sources of funding are a great way to do that. And so the idea here is that you should really start thinking creatively and broadly about how you self-identify. So I think we have a large enough sample size in the room. Can I get a show of hands if anyone here is a twin? No twins. Okay, how about anyone who's left-handed? Okay, so we have a couple left-handed people. So I encourage you to go home tonight and type in scholarships for left-handed people. You will be amazed. You don't have to study a specific subject area. You don't have to be particularly talented at anything. All you have to do is be left-handed and you're eligible for that aid. So that's just one example. If you're a vegan, if you were a Girl Scout or a Boy Scout, or belong to any other community organizations, think about religious organizations that you or your parents may belong to. Even putting out a message on your social media networks can go a far way. So we had a student a couple years ago who posted a status on Facebook and said, just got into my dream school, anyone know of scholarship opportunities? And sure enough, a few hours later, someone commented, yeah, my parents belong to the Kiwanis Club in our neighborhood. Here's the link to apply. She was one of 4 students that applied for the scholarship. She spent 2 hours on a scholarship essay and won $20,000. I don't know of any other job that pays a rate of return of $10,000 an hour. Certainly if you know of one, please come up and let me know after the session. So really, yes, it takes work and it takes time to search for these aid opportunities, to put the message out there that you're looking for them, but it's a wonderful return on investment if you do spend the time. It's kind of like the lottery, you have to be in it to win it. So I really encourage you to spend time working on this. And you also want to keep in mind that most outside sources of funding, those deadlines are going to be September, October, November of the year before you want to start graduate school. So especially for those who are seniors now, if you're thinking of going to graduate school straight from undergrad, now is the time. Don't wait until you're admitted into the program, because by then, all of the deadlines, again, have passed. So these websites listed up here are a good place to start. All of these are going to have different listings of aid that you can apply for. But also, there's this really amazing thing called Google that we have now. So I would definitely encourage you to do some research. Write yourself a keyword list and search every 2 weeks, because what you might find this week, once those deadlines pass, new scholarships will be posted. And so certainly, if you continue looking sort of throughout the fall and winter, there will be opportunities for you to apply to. The last point about this that I wanted to make is that you should also look at our financial aid websites. Each of our own institutions, besides these pages listed, will also offer other types of aid, apart from our institutional aid, that you can also then search those websites to apply for. Definitely encourage you to look on your undergraduate website as well. There may be scholarships for graduate school as well.
So that completes our PowerPoint. Just a couple of housekeeping. Is a tablet floating around? Where is it? Okay, who has not filled it out yet? Okay, so it still needs to work its way around. If you haven't already done so, please feel free to grab stuff off the table. We're done with the presentation, so you can just go ahead and grab it now. And then what we're going to be also doing is answering any questions that you may have, any general questions that you may have about our presentation. Yes, sir?
For 5-year programs that you apply to, let's say when you're a junior, I guess in Hopkins' case, is that application, do we do that like the same deadline that like
no.
seniors were?
Yeah, so it would be slightly different. So you would be applying, I believe it's after your junior year, going into your senior year, if that's correct. I just want to make sure that, I just want to give the wrong information, but I believe that is correct, right?
Yeah, and we
Going
actually
in.
have a separate information session specific to that that's in the first week of February, so you'll hear announcements about that as well.
But yeah, so thank you for bringing that up. I think that's an excellent point, especially here. So if you guys are thinking about that, there you'll see in the pamphlet as well as online that there's only a certain number of departments that actually offer that program. Just be mindful of that. So if you're not looking, if you're looking in a specific program, I can talk to you afterwards to kind of figure out if that will work. But it will cut off essentially. So all of our usually our master's programs are about 2 years, so it would just take 1 year off of your program.
When you guys talk about experience in public health, does that usually means post-baccalaureate experience, correct? After your bachelor's?
Yeah, typically, I mean, again, it does vary by program, but when, like I was mentioning before, for our MPH program, we do mean post-baccalaureate. So it would have to be, and it would have to typically be a paid experience for a long length of time, because a lot of times, people are trying to smush together a bunch of different, we're trying to look for kind of consistent experience. So, a perfect example would like be the Peace Corps, AmeriCorps, those are more stipend-based, but still kind of consistent experience within a public health setting. Also, here in Baltimore, there's tons of organizations that you can get involved with after graduation, or city health departments, things like that.
If there was something like a fellowship, like a Fulbright, for example, that's not paid, but is that considered?
Yeah,
Same
I
lines?
would say that would be also considered kind of on the same lines as like a Peace Corps experience or something like that, where you're still in the field doing work, but just not necessarily getting paid for the work, but it would be very similar. We're just looking for those that after the undergraduate experience.
Yeah, and for example, on Columbia's, like if you go on our admissions page, a lot of departments list some experience preferred, which in fact does mean that we do accept students straight from undergrad. But what we want to know is, what experience helped you figure out your interest in public health? And one of the things I like to tell people is that there is pretty much no job in the world you can't connect to public health if you think and try hard enough. So a really good example is we had an applicant come in who was concerned that she wouldn't be considered competitive because although she had 2 years of post-grad work experience, it wasn't in a express public health organization. And so we asked her, well, what do you do? And she said, well, I work on Park Ave and I write jingles for advertising companies. And we said, well, that's absolutely public health related, because if the right message doesn't get to the right people at the right time, people can end up sick. Zika is a perfect example right now. If you visit New York City, there's subway ads posted all over the place about how to prevent contracting the Zika virus. And so certainly a marketing skill set is very important in the public health industry. As long as you can connect the dots between your experience and where you want to go in public health, that's considered experience sort of on our end. So really I would say make sure you're looking at each institution and feel free to reach out to the admissions offices if it's not clear, because even like on our website it's a little vague. It says some experience preferred. Well, what does that mean? So always feel free to reach out to the institutions and just clarify that so that you're making sure the programs that you apply to you're really eligible for.
Do you need a master's to get a PhD, and what are the benefits of each?
So at Hopkins, most of our programs don't require a PhD, and a master's degree prior to going into a PhD program. We do highly recommend it though, just because, and as well as some experience as well, just because not only are we looking for certain set of skills and just experience within public health, but it's also important for you as you're kind of thinking about what your dissertation is going to look like, things like that. Not that you have to have a full-blown thesis statement during your application process, but it just kind of will help you along the way, and you're going to be competing with those that have at least some minimal experience as well as a master's as well.
And Harvard's the same as Hopkins in that I'll just add that you should have research experience if you're a bachelor's wanting to go into a doctoral program. They want to see evidence of research, either individually or as part of a team. One of your recommenders should talk about your ability to do research, and I would strongly encourage you to reach out to the program and talk to them that you're planning to apply so you can get their perspective on what makes a strong application. There was, yes?
So do any of the other institutions besides Hopkins offer that 1 year? Hopkins offers a Master's of Science in Public Health. Do any of you guys do that for students who have received a public health bachelor's degree?
So she's asking about the Master's of Science in Public Health, and do we replicate that? We do not. So the closest thing for us is the 2-year Master of Science or the Master of Public Health, 65 credit if you have 2 years of work experience.
Yeah, and for Columbia, it's sort of similar to that. We don't offer an MSPH per se. We do offer Master of Science programs, which some of them, depending on the program that you're entering and the coursework that you've taken before. So for example, if you were focused your public health undergrad in biostatistics and then you entered our Masters of Science in biostatistics, it is sometimes possible to complete that within 1 year, but typically students are in the MS program for 2 years, and same with our MPH, it's a 2-year program.
In the back was a question, yes, sir?
Sorry if I missed this, but can you apply to 2 programs at once? Like in particular, could you apply to an MPH and a doctoral program?
So it is possible. You certainly can apply to both programs at the same time. I've seen it done before. You just want to kind of be mindful. It will be 2 different applications. In Sophis it'll be, I guess, a little bit easier to do it because it's, your CV will essentially be the same, and then your transcripts and things like that would be the same, but you have to be mindful that it will be another statement and things like that. So you just want to make sure that you're applying to the programs that makes the most sense to you. And also, I've seen some students that have applied to a master's and a doctoral program within the same department. You may want to think about that a little bit, just because, you certainly can, but just kind of thinking about taking the time to really think which program makes the most sense for what types of skills you're looking for. And then also, it may be worth a conversation with the department that you're applying to, especially if you're looking into a doctoral program, to see if you have the experience that they're looking for and things like that. Just because you want to make sure you're spending your resources correctly. So.
And for Columbia, we actually only allow you to apply to one program per year, so sort of what Lauren was just saying, really we want you to do your research before submitting that application to make sure that you're applying to the program that truly is the best fit for you. For our PhD programs, it is possible to send us an email and say, if I'm not admitted into the PhD, I'd like to be considered for the master's in that department. You wouldn't be necessarily submitting a separate application because we have restricted our SOFIS so that you can only apply to one program at Columbia per year. But also, I would really encourage you to have a conversation with the department, as Lauren was saying, and they will be transparent in saying, you're coming from undergrad, you're going to be more competitive as a master's applicant than a doctoral applicant, or you already have a wealth of research experience, go ahead and apply to the PhD. So really make sure you're kind of doing your research beforehand.
And at Harvard, you can apply to the PhD and then anything else, but you can't apply to any master's, 2 masters, or master's in DRPH. Was a question? Yeah.
If you're interested in potentially applying for the dual degree programs, do you need to apply for both schools at the same time, or would you be able to apply for instance, the master's in public health now, and then if you got admitted once you're doing 1 year in the program, then apply for the second school?
Which dual degree are you interested in? Do you know?
Yeah, MPH and law, JD.
Okay, so for Columbia, we do prefer that you apply to the 2 programs at the same time, so in the same application cycle. Typically, the way that the law school works is you would attend your first year at the law school, and then you come to our accelerated MPH, finish that in 1 calendar year, then return to the law school and complete that degree program. So you would want to apply at the same time.
At Harvard, we want you to apply to the law school first. Take the LSAT, do the law school. During your first year of law school, apply to the MPH program during your first year. It's a lot easier for you. You're in the same cohort process if you do apply to both at the same time. But it's just a lot easier rather than you can focus on the 2 things separately. Yes, over here.
So I saw that for future employers that consulting firms like McKinsey and Deloitte do take public health students. I just wanted to ask about how those consulting firms are related to public health and what they're looking for, I guess.
So usually the consulting firms have areas of specialties that conversely go through all the different corporations that's out there. And so they usually, there's a growing interest in public health with regards to policy and allocating resources to public health causes, identifying how to make the case to be an advocate for public health for senior people in corporations. And so they'll look for those type of consultants with that skill set that can be very beneficial. And some of those corporations have global interests as well, so there could be some global opportunities they can provide some guidance to. And just as a clarification, a lot of these companies come to our campuses to speak to prospective students that want to be employees, and they'll come and talk about what they're trying to do and the type of students they're looking for. We'll take one more question. One more? Did you have a question?
Yeah, but I have another question. So sometimes when public health people with MPH graduate, there's been talk of like an MPH bubble and like oversaturation in the field, and so it's hard to find a job and employment. And so like specifically how do your career centers, like besides doing like mock interviews or posting job opportunities, is there like, you know, a certain success rate to offer like good employment for your graduates?
Well, that's a very good question. She's asking about the MPH, since there's a little bit of a saturation of folks getting that. There are a growing number of MPH programs that are out there. There's a lot of choices out there. But they're also becoming very specialized. So it's not really the broad interest. You're seeing things popping up. For example, there's a big interest in urban public health for the MPH. I don't think we offer that. Do you offer urban?
We don't have a specific concentration in that area, but a couple of our departments have research within that area. Yeah.
And for us, we don't offer it, but Northeastern down the street from us do. So my point is, there's a lot of specialization going on that's narrowing down the MPH interest. The job market is still pretty good though. It has not been affecting employment. If you reach and contact our career service offices, they'll let you know what's going on out there. But the job market is very strong. There's still a growing need. The one thing I mentioned about public health, and it's, as indicated of this room, we are looking for folks from very diverse backgrounds. because people want to hear from public health experts that know them, their culture, their heritage. All these levels of expertise is very, very important. So it's a very global need for public health, as well as the diverse part of the United States. So I would just take a look at our websites.
Yeah,
So,
the only thing I would add to that is definitely, I would say, if you grab one of the Columbia View books or go on our website, we have some really great information about where our students go. And I think a lot of times when people look, there's some great infographics that tell you essentially 90% of the students are finding jobs within public health within 6 months of graduation. And so certainly I think looking at the career services offices and what resources they provide is really important, because you're making not only an investment for the 2 years or whatever for graduate school, but also the career services are really going to be an investment for life. And so making sure that they have the resources available to help you with your job search is very important and a great question.
I have 3 quick things to add. I want to capitalize on Vincent's mention of this specialization. No disrespect to our lovely presenters, but there are other schools that will be coming through. A lot of that is scheduled through the Career Center, so do keep your ear to the ground on other groups to talk to, because they do try to bring someone in person that you can really point these questions to. That said, right now you have a Naomi and a Vincent and a Lauren, and we've got the room until 6, so please take advantage of that. All this contact information is here for a reason. I also really want to talk about recommendations. I think it was great to hear, especially at the master's level, those really are a view into who you are as a person. So now is the time to start thinking about who you have relationships with, because the first step to asking for a recommendation is having a relationship that allows you to ask for that. So office hours exist other than just at exam time. Go and get to know your professors, ask them how they got interested in what they're doing. There is no one story that leads a person into public health. So really do try to make sure that people know who you are, so that you have that bank of advocates when the time comes. And finally, we do have some food, so please make sure that you take some on your way out. But let's please give a really warm thank you to this group.
And the tablet is where? And who needs to fill it out? So please make sure you fill out the tablet. Please grab materials. Grab some for your friends who couldn't make it.
And you can always come to the Public Health Studies office with questions too. If it comes to you late in the night tonight, we'll be there tomorrow.